Dear colleagues and friends, welcome to our ELSI Dialogues webinar series, this time on ethics of AI. Ethics of AI in imaging, ethical and societal implications is today's topic. And this webinar is featured thanks to Big Picture. I remind you that this webinar is being recorded and will be made available online at a later stage. Briefly, some background about BBMRI. BBMRI has the scope to facilitate access to samples and data collections across Europe to advance biomedical research for the benefit of the European citizens. To reach this goal, BBMRI ERIC relies on a network of national nodes in the member countries, as well as a team of interdisciplinary experts from medicine, social science, ethics, law, IT, quality management, patient communities, and industry partners, with shared values of facilitated access to process in healthcare and disease prevention. In 2013, BBMRI ERIC was set up as a distributed research infrastructure and to date consists of 20 member states and one international organization, making it one of the largest research infrastructures for health research in Europe. More than 20 member states, it should actually say, and the full list of members you see here. About ELSI services and research, we provide support on ethical, legal, and societal issues. We operate on the basis of a federated model in partnership with a network of experts from academia and practice across both our national nodes and project partners, alongside with three cornerstones: research, service, and training. These cornerstones inform and carry each other to guarantee state-of-the-art support for our community. About Big Picture. Big Picture is a public-private partnership funded by the EU Innovative Medicine Initiative, IMI, bringing together academic institutions, small and medium-sized enterprises, public organizations, pharmaceutical companies, and a large network of partners. Big Picture will set up the first European ethical and general data protection regulation compliant, quality controlled and community-based platform in which both large-scale data and artificial intelligence AI algorithms will coexist. This project has received funding from the Innovative Medicine Initiative through joint undertaking under the grant agreement 945358. This webinar is featured by Big Picture. Briefly on today's speakers, ELSI Dialogues on the Ethics of AI, Dr. Melanie Goisauf, with a background as a social scientist, holds a doctorate with honors in sociology from the University of Vienna. She also studied at the Royal Holloway University of London and is a graduate of the postgraduate program Sociology of Practices of the Institute of Advanced Studies, IHS, Vienna. Her dissertation was awarded the prize for best thesis in 2017 by the research network Gender and Agency of the University of Vienna. Since 2008, she works as a lecturer at the Department of Science and Technology Studies at the Institute of Sociology of the University of Vienna and University of Malta. Currently, she is senior scientist at the European Infrastructure for Biobanking, BBMRI ERIC, and her research focus is on ELSI issues of biobanking, in particular on the governance and stakeholder engagement, as well as gender, knowledge, and artificial intelligence. Dr. Monica Cano-Abadia is a moral and political philosopher. In 2014, she obtained with honors a PhD in philosophical studies from the University of Saragossa. In addition to an MA in philosophical studies, with a specialization in moral and political philosophy. She has been a postdoctoral fellow at the Center of Advanced Studies, Southeast Europe, University Rijeka, and the section of Political Philosophy, University of Graz. She is currently a senior scientist and the Gender Equality Diversity Specialist at BBMRI ERIC, and a lecturer at the Master's Program in Gender Studies, University of Graz and Autonomous University of Madrid. Her current research focus includes sex and gender and the ethics of AI in biomedicine. Here, briefly, the abstract of today's presentation that focuses on how AI application in medicine are hoped to improve healthcare and to advance health equity. Not going into further details for not losing further time, I now hand over to my colleagues for starting the webinar. If you have questions, please put them in the chat. We will turn to them at the end of the presentation. Melanie, Monica, the floor is yours.
Thank you for the introduction, Michaela, and welcome to the webinar. The title, as you heard, is Ethics of AI in Imaging, and we focus today on the ethical and societal implications. And as you can see, we use ethics of AI or AI more broadly. How is it like it is used also in the field in kind of an umbrella term for various approaches. So AI encompasses the ability of a machine to imitate intelligent human behavior. And a subfield of it is machine learning, which is widely applied to medical imaging. And also the whole field also includes deep learning, which produces data with multiple levels of abstraction. The next slide, please. So what we now see is an evolving field of ethics of AI, and I just used a screenshot of some of the book covers here to show that a lot is going on right now in the field. And the focus of ethics of AI is to carry out studies on the far-reaching consequences and the implication of AI in several areas of society. And along these lines, AI is also steadily gaining importance in the medical field. And the patients and other societal groups are becoming confronted with complex questions concerning the scope, for instance, of informed consent, biases that may result in inequality, and risks associated with data privacy and data protection, but also open questions regarding responsibility and liability, which are really important questions, especially in the medical field. The next slide, please. In BBMRI, we, the ELSI team, are involved in 3 projects on medical AI, as mentioned, big picture. The goal of the project is to set up a platform that brings together pathology images and artificial intelligence algorithms. Intervene seeks to advance AI-facilitated analysis of complex medical data to develop genetic risk scores. And you can image, which builds a highly secure, federated and large-scale European cancer imaging platform with capabilities that will greatly enhance the potential of artificial intelligence in oncology. Next slide, please. And in order to use the synergies of all the 3 projects, we organized a workshop with some of the project partners and other experts earlier this year. And we had a really thought-provoking exchange on the topics you see here, for instance, in how to embed ethics into the development of AI, how to do an algorithmic impact assessment, but also biases and challenges around trustworthiness and explainability of AI, and also the clinical applications. What you can see in the background is the collection of some of these thoughts, which we used on a tool to collect kind of these electronic stickies. And we are now in the process also to do the analysis on that. Next slide, please. And as I just mentioned, we are in the middle of the research. but we can already point to a publication in Frontiers in Big Data. The article is open access, and you can use this QR code to access it. And this article is also the basis for today's webinar, and its focus is on radiology. Next slide, please. So with now a focus on the ethics of AI in radiology, we see here from a review of the literature that AI is seen as a promising innovation in the medical field, and AI systems are expected to have a significant impact in radiology. And these technologies have been developed to help improve predictive analytics and diagnostic performance, and specifically to improve the accuracy and ability to support personalized decision-making. And the scope here, or the aim of ethics of AI, is to ensure that advances in AI systems and advances in AI ethics do not contradict one another. And in the paper, we contribute to the discourse on ethics of AI in radiology by reviewing the state-of-the-art literature, and this analysis was guided by two key questions. First, what types of ethical issues are raised by the use of AI in medicine and biomedical research? And second, how are these issues being tackled in radiology? Next slide, please. So we carried out a systematic review of peer-reviewed state-of-the-art academic literature published after 2017. And 5 electronic databases were searched between July and December 2021. And after screening a full text of the final sample, which consists of 56 articles, were analyzed using thematic analysis. Next slide, please. So the analysis of the literature shows 3 main areas in which changes are expected. First, that AI will significantly improve diagnostics and patient care, for example, to maximize image quality, support the personalization of treatment via predictive analytics, resulting in fewer unnecessary procedures. And second, it should benefit end users, for example, societies and healthcare providers, by improving the health of populations, and also reduce the costs of healthcare. And finally, the expectations regarding radiologists are ambiguous, with some scholars highlighting the fact that AI will outperform clinicians, or that AI systems will serve as physicians' partners to deliver improved healthcare. Next slide, please. Sorry. Despite the hype surrounding AI implementation in healthcare and radiology, some authors highlight the challenges that can arise. One key challenge concerns the data that are used to train AI, such as the lack of labeled or annotated data. The affordability of required computational expenses poses another challenge, which may exacerbate disparities in access to radiology AI. Another challenge is automation bias, which is the tendency for humans to favor machine-generated decisions, ignoring contrary data or conflicting human decisions. And finally, the implementation of AI into clinical practice. It is not clear how to effectively integrate AI systems with human decision makers. Next slide, please. The challenges highlight specific institutional and resource-related issues, which also determine how ethical and social implications are reflected upon. And this becomes tangible when examining the 2 major recurring themes identified in the reviewed sample, which is black box and bias. A black box is defined as something whose inner workings remain opaque, or lack justification, which means it's unclear how a conclusion or recommendation is reached. And this lack presents a major ethical concern, and also raises the questions whether in healthcare black box AI should be used. And black boxed medicine, so to say, may lead to a loss of medical understanding and explanation, and thus medical advances. And these challenges are associated with considerations about the impact of black box AI on validity and the potential harm for patients, as it can have negative effects on underrepresented or marginalized groups. And it can pose risk for radiologists who are expected to validate something that they cannot understand. And the latter is also associated with depriving the patients of the ability to make decisions based on sufficient information and justification, which contradicts the ethical requirement for the patients to exercise autonomy by giving their informed consent, something which I mentioned earlier. And also AI systems used in healthcare may have both a racial and gender bias. And many algorithms in medicine have been shown to encode, reinforce, and even exacerbate inequalities within the healthcare system. And biases are introduced due to the data used to train algorithms and the labels given to the data, which may carry human values, preferences, and beliefs. And AI systems may mirror the implicit human bias in the decision-making. Next slide, please. And the approaches that can be taken to meet the expectations described and to tackle the challenges are often formulated as principles in the literature. And to manage the risk inherent in the use of medical black boxes and the resulting bias, explainability has become one of the key principles in the area of AI ethics, and especially in the context of healthcare. Explainability and interpretability are often used synonymously by different authors in the literature. And the issue of interpretability and explainability has also interesting ramifications with reference to contestability, which is understood as the capacity of individuals to contest and counter medical decisions. And also in line with that, the European General Data Protection Regulation, the GDPR, in that it also emphasized the patient's rights to receive an explanation, and this is one of the top priorities in machine learning research. Next slide, please. Another guiding principle here is trust or trustworthiness. And I put a quote here pointing out that trust is a fundamental principle for interpersonal interactions and is a foundational precept for society to function. And with that also, it also then is a key requirement for the ethical use of AI. There is some consensus in the literature that black boxes and the lack of interpretability and explainability can also result in a lack in trust or trustworthiness, and also in the acceptance of AI systems by clinicians and patients. One author notes that, quote, the medical profession is built on various forms of trust, and how these forms of trust, its conditions and social and institutional context, what it means would require also a deeper analysis. Next slide, please. Other guiding principles are responsibility and accountability. So AI's lack of transparency could also have an impact on matters of responsibility and accountability. And it has pointed out that users should be able to trust AI and its organizations to fulfill their promises. And building trust should be encouraged by ensuring accountability, transparency, and safety of AI, as one of the of some authors mentioned. And lack of transparency complicates issues of liability and undermines the ability of clinicians to act with integrity. So one approach is the so-called human-in-the-loop perspective, which means that keeping the liability and responsibility within the field of responsibility of the radiologists and their employers. Next slide, please. And this is the last slide on the guiding principles before I hand over to my colleague Monica. And this is about justice and fairness. Justice is one of the 4 principles of bioethics, and the association between injustice, discrimination, and unfair decisions made by AI systems has been also linked to bias in the reviewed literature. And I use a quote here, discrimination and unfair outcomes stemming from algorithm has become a hot topic within the media and academic circles. And finally, biased AI systems may lead to unfair discriminatory behavior or mistaken decisions, and thus to so-called algorithmic unfairness. And with that, I hand over to Monica.
Thank you, Melanie. I will continue now outlining the outcomes of our reflection in the status of the field of ethics of AI in medicine and imaging based on our literature review. We have observed that in the discourses of ethics of AI in medicine, there is often not a clear definition of the socio-technological conditions under which the expectations around AI can be met and how the challenges can be managed. Only a few studies define how AI tools interact with pre-existing systemic harm that already exists before the application of AI, and how AI can contribute to this harm, and how complex ethical and societal issues might be amplified using AI tools. Bias is usually not framed in the context of power relations and societal conditions, and also there are no references in general to existing body of research on, for example, how gender and race shape and affect biomedicine and healthcare practices, or how gender and racial bias in algorithms could have a negative impact in certain areas of society. There's ample literature on the topic in these areas, and we found a lack of dialogue in that sense. Next slide. When it comes to mitigating bias, diversity in the data sets is a recurring wish. Nonetheless, we have observed that few studies have been performed on intersex, transgender, or non-binary individuals due to narrow and binary background assumptions regarding sex and gender. Ignoring how certain identity traits affect the application of AI systems in healthcare can lead to the production of skewed data sets and harm certain minorities and certain people and groups of people. The results of our literature review indicate that rather than ignoring sex and gender or race dimensions, close attention must be paid to these dimensions. Next slide, please. In this sense, we have here a proposal by Cirillo and colleagues who have proposed to introduce desirable bias to counteract the effects of undesirable biases. Undesirable biases are biases that lead to stigma, discrimination, or even adverse effects and ineffective treatment to certain populations. And that stems precisely from unrepresentative samples and data sets. For Cirillo and colleagues, enhancing desirable biases can help mitigate the harmful effects of undesirable bias. And in order to do so, understanding sex and gender differences is crucial. So having a look at this already existing literature on sex and gender to be able to understand these sex and gender differences would be a crucial step. Next slide, please. In the case of breast cancer, we tried to focus also our literature search in imaging in breast cancer, although the results were not very numerous. But in the case of breast cancer, we have identified breast density as one of the most important factors for bias, simply because the algorithms and also humans can have a harder time identifying the lesions in the tissue. There are intersecting factors that contribute to different breast architectures, such as age, ethnicity, or socioeconomic status. And precisely this intersectionality of these traits deserves more attention, as this kind of bias associated to breast density can affect detection, diagnosis, and subsequently treatment. Next slide, please. Simply ensuring diversity in data sets is not enough. And more research is needed to understand how discrimination intersects with socioeconomic factors to keep bias from being introduced into healthcare algorithms through structural inequalities that already exist in society. In this sense, anticipating structural bias in data sets and understanding the social implications of using AI systems before their implementation is considered best practice. Some authors even propose that failing to do so, failing to anticipate these implications of using AI should be qualified as scientific misconduct. Anticipating these effects of implementing AI will require reflecting on how social categories are constructed in big data-driven research and how the underlying social classifications and categorization systems that we use are incorporated into and reproduced in the knowledge that is produced from analyzing existing data sets. Next slide, please. The discourses of ethics of AI often make a reference at the creation of technical solutions for problems that are related to bias, fairness, transparency, trustworthiness, etc. And while technical remedies are crucial, it is important to pay very close attention to human and systemic, institutional and societal factors that are also significant sources of bias as well. So combining these perspectives, the technical and the more paying close attention to societal aspects, will have a more successful outcome when it comes to taking all forms of bias into account. From our perspective, it is fundamental to establish interdisciplinary dialogues to analyze together how AI technologies are created within our society and also how AI technologies impact our society. Next slide, please. When it comes to trust, that is one of the big topics in the field. There are a few initiatives that highlight the importance of trustworthy AI. When it comes to trust, for us, especially as a sociologist and a philosopher, it is important to understand trust as not only a technical problem, but as a complex issue that needs to be addressed, and that it is built on the foundation of social relations. So understanding this social perspective, this social component of trust is fundamental when it comes to understanding trustworthy AI. For instance, healthcare practitioner-patient relationships are based on trust and empathy, and decision-making in the medical context, and especially in connection to technology, is often based on gut feelings that are very difficult to put into words. Trust needs to be understood then as a complex, situated, context-dependent, and relational concept that involves several trust or trustee relationships, such as trust in persons, for example, scientists who trust each other, patients who trust scientists and clinicians, etc. Relationships also between persons and technology, and relationships within institutions. So multi-layered levels of relationships play a role when it comes to trustworthy AI. Next slide, please. In building trust, then, also the embodied experience matters, the lived experience of people involved, of real people involved in the process. And this experience occurs as an emotional reaction, as well as these aforementioned gut feelings. To ensure trustworthiness, then researchers should understand how trusting relationships are constituted via the social process, and how trusting technologies is established and sustained, and how also under which conditions AI can be deemed trustworthy. We are working currently on applying this perspective on the projects that we are involved in, and also soon we will be able to show more outcomes on understanding trust in AI applications with this social component incorporated. Next slide, please. With this, I will conclude. We have then, to conclude, identified a lack of broad understanding of ethical and societal issues related to the use of AI in healthcare in the literature that we have analyzed. We have observed that this current literature does not delve into the broader origins and implications of bias, relating it to broader societal and systemic aspects, and especially when bias is treated only as a technical problem with a technical solution. And we believe that integrating a social science perspective into the analysis of ethical and societal issues associated with AI is crucial to understanding the scope of these issues. In sum, we advocate more interdisciplinarity embedded throughout the process, starting from early stages of AI development. And with this, next slide, we can say thank you to everybody that came here, and we look forward to your questions or comments if you have any. Thanks.
Thank you so much for the excellent presentation. Indeed, we are now coming to the Q&A session, and for this, we are stopping the recording.